Greetings, it's New Zealand naturopath Eric Backer, author of Candida Crusher. Thanks for checking out my case history number 2. We're going to talk about a patient called Susan, 39-year-old patient. Susan's not her real name, of course. It's a real case, but the name's been changed to protect the patient's identity. So this is an Australian patient I saw not that long ago. I'm just going to read out of my book. Susan is an Australian lady who visited our practice several years ago, complaining of a number of chronic health problems that had plagued her for over 20 years. Many of Susan's health issues are typical of some of the clinical complaints that people have when they endure chronic and generalized yeast infection. This lady suffered from sinus and hay fever all her life and has taken many different pharmaceutical drugs for her allergies, but has kept changing them because they were of only temporary relief. Usually antihistamines, drugs like that, antibiotics, or kind of anti-drugs. She had learned to live with a stuffy or perpetual blocked nostril, postnasal drip, sneezing, itching, upper palate, sore throats, and dark circles under the eyes. She also suffered from the worst headaches imaginable since she was 16, at times like a nail piercing her skull, as she described them. These headaches were typically worse 4 days before her period. Susan went to a doctor about 5 years ago, complaining of the headaches from hell, and he referred her to a neurologist, who concluded after an ECG, so that's like a brain scan, that all was well and that the headaches were caused by stress and tension and to take analgesics. Several $100s later, and none the wiser, the patient was given hundreds of tablets of acetaminophen and various other drugs like ibuprofen to take, and basically just left on these drugs. When Susan was in her late 20s, she started to become more aware of the fluid retention she was suffering from, including huge weight gain since her teens, over 150-pound weight gain. After eating a carbohydrate-rich meal, she would bloat, retain a lot of fluid, and gain a lot of weight. As much as 8 pounds of fluid could be gained within a matter of a few days. Her doctor told her it was because of salt. So she excluded all salt from the diet, only to find it made no difference at all. What she did notice, however, was that her fluid retention was a lot worse before her menstrual cycle. And also it coincided with a lot of depression, which is probably estrogen dominance, which we commonly see. This lady was placed on the Candida Crusher program. We had significant improvement with this patient. She was eating all the wrong kind of food. She was living in a very stressful relationship. She had a terrible job, which she didn't like. So typical case again where we see an unhappy person, wrong kinds of foods, poor lifestyle habits, loads of pharmaceutical drugs. All the tests and scans come back completely normal, so therefore the patient must be crazy. And they basically get bounced from one doctor to a naturopath to a chiropractor all over the place. And that's often when I end up seeing these sorts of people. Many women I see with Candida have got terrible headaches, sinus problems, ear, nose or throat, congestion. Often one nostril will be blocked. They could have facial pain. Many of these things are compounded by severe intestinal Candida. And lots of these patients also have vaginal thrush. So when they go to the doctor, they basically put on multitude of different pharmaceutical medications. And of course the lifestyle isn't changed, the diet isn't changed, the symptoms continue on, and as they age, the health breaks down further and further. So what can we learn from Susan's case? Well, what we can learn here is obviously big changes need to be made. And I implement those changes slowly over a period usually of 2 to 3 months. So the longer a patient's been unwell for, the slower I make the changes. I prefer to have people make positive changes over a prolonged period of time. They're going to be adopted as permanent lifestyle habits. That's how you not only get well but maintain wellness, is by making those changes long-term and permanent. This is why most diets are a crock and why they never work with people. They're short-term. They're a waste of time, and people do them temporarily to drop, a few dress sizes, and then they go back to exactly the reasons why they gained all that in the first place. And this is what we call yo-yoing. And many times they get a severely disordered digestive system. So here's an interesting quote from a very well-known American doctor, Dr. Leo Galland from New York. Actually, one of America's leading integrative medicine practitioners, Dr. Galland. This is what Dr. Galland says. The intestinal tract is one of the most important parts of the body as far as whether one is sick or is well. I'm not talking just about allergies, but the reason we're seeing an increasing prevalence of food intolerance is because of an unhealthy and imbalanced gut flora. The problem may be with the diet itself, or maybe from antibiotics or parasite infestations like yeast infection. So Dr. Galland was one of the first doctors to really recognize the connection with the gut and many other parts of the body. And as you can see in this case of this lady here, the gut started to break down and she started to get problems, all throughout her body. So that's case number 2. Thanks for tuning in.